Hey there, it's me, Brooke, with PEHP again. You probably remember me from the medical benefits video. Luckily, even though the city has 2 plans for dental, it's a lot easier to explain 2 plans than it is 1 medical plan. So let's get started with dental. You as a city employee have access to 2 different dental plans. The premium for dental, no matter which plan you choose, there is no cost share with the city. You have to pay the full cost of the premium. The options are preferred choice and premium choice. One has a higher premium because it has a higher annual maximum it will pay for your dental care. Once you hit the annual maximums, you won't have any more benefit to cover your dental expenses. Standard things like a couple of cavities and maybe even a root canal would be a good fit for preferred, but more expensive things like a bridge or surgery would benefit from a higher annual maximum benefit from the premium plan. Other than the higher annual maximums, both plans share the same details you see on screen. We may have already scared you about balance billing when we talked about medical coverage, but it is especially prevalent in dentistry. Make sure your provider is in-network. If you find your dentist is not in-network, you can nominate the provider to be in-network. There's a form on the PEHP website for you to nominate a provider, dental or any medical providers, to be in-network with PEHP. It's up to the provider to decide if they want to be in-network. Just because you nominated a provider doesn't mean any services you get will be covered in-network. They have to be approved prior to the service. So if you've had the same dentist since you were a kid and they're out of network, you can discuss with them joining the PEHP network or negotiate billing to continue seeing that provider. Orthodontia is covered, but you have to be with the city 6 months before you can receive the benefit. Don't get banded in your braces or get Invisalign before you've been here for 6 months. PEHP will pay 50% up to a lifetime maximum of $1,500 per person. Your braces need to cost at least $3,000 to receive the maximum benefit. If you or a dependent are currently banded in braces, let's say a year into 2 years of treatment, PEHP will not cover any expenses related to that phase of treatment until it's completed. So you or the dependent wouldn't get any benefit from PEHP until the braces are off and you move to the next phase of treatment. For any claims, you'll need to include a copy of your treatment plan with estimated costs and length of treatment. There's no age limit or restriction on which orthodontist you can use. You can shop around and see who works best for you. I hope you got the information you need and can now compare and contrast the dental plans to know which one is right for you and explain how and when you can participate in the orthodontia benefit. We will have a representative at Salt Lake City Orientation to help you with any specific questions you have about dental benefits. And always, thank you for working to keep Salt Lake City a great place to live and work.